Should artificial intelligence be just assistive? Should it be fully autonomous or should it be semi-autonomous? Let's find out. Hi, I'm Junaid, neurocritical care, stroke and epilepsy specialist, and we're going to talk about artificial intelligence in healthcare. In the last lecture, we discussed what is the hype, what is the impact, what are the leaders saying. But in this particular lecture, we're going to see what is the current status of it, what should be the status of it in terms sometimes, because at the end of the day, we're looking at human lives and where the human in loop versus total machine control needs to be. We're going to talk about what the current status of artificial intelligence in healthcare is. Okay, let's get started. So here's the thing, what artificial intelligence should look like, and people have different opinions on it. And I'm going to be honest with you, this is my opinion. At the end of the day, artificial intelligence needs to be what? First of all, foremost is that artificial intelligence is not here to replace doctors, period. We haven't been that high of empathy, and at the end of the day, if you look at the mirror neurons, speaking as a neurologist and a neuroscientist, we do catch up human empathy with those mirror neurons. So there is just no way that they can actually come, that empathy is not really truly transferable in terms of machine. It is definitely impacted with living creatures. We are wired that way. And there are ways to simulate that, don't get me wrong, right? There are pillows with heartbeat and there are other things that we have done with warmth and everything to replace, let's say, a cat. So there are things that are being done, but at the end of the day, our human physiological changes, the way we acquire information, not just through our eyes and ears, but overall, it is definitely impacted by living people and living creatures like, pets even. So definitely overall, we are definitely impacted at the cellular level, at the neuron level, how things are going to be done. So artificial intelligence, the whole point of it is not to replace physicians, right? Nobody really is working on it. I know there's a lot of hype going on, but we want to, and we really do want to highly augment all healthcare workers and not just physicians. Augment in their decision making, augment in their reach, augment in their effectiveness so that they can treat the patient better, and then patients can also give feedback better. So all in all, the whole point is to augment, which brings us to the second point, assistive. The difference of assistive versus non-assistive is being that they are not truly making the final decision. When there is an assistive technology, what it really means is that it's assisting you through the process. It is not basically making the final decision. Look, here's the point. Healthcare and military are what we call high stakes industry, right? In both of them, there's a general consensus within the ethics of artificial intelligence that AI cannot make the final call. I mean, even if you design it, you can put algorithms, etc. But within those two fields, within these parameters of field, AI should remain to be assistive in nature. And lastly, it should be applied, right? I mean, the point of it is that if there is a clinical value that it brings, right? People can just joke around about artificial intelligence that they're going to apply on this or apply, they're going to do this. Great. I get all of these pitch decks and even ideas and some research papers, for God's sakes. I wonder, what is the clinical application for it? So we really need to concentrate on artificial intelligence that can be applied. Lastly, it should truly be ambient. What do I mean by that? Ambient means that it is lost within your background. It is spatially working seamlessly within the current workflow. So if this is an ambient technology, then it works beautifully. As a matter of fact, what we have been doing with voice activated assistants like, X or, etc., because I have all three of them in this room. If I'm going to say it's going to start, pinging. What I'm saying is that what you use like voice assistive technologies are truly ambient. And those technologies which are ambient and working in the background are going to be the most successful one in the artificial intelligence. And the most last one is autonomous. And this is very, sort of an area where people feel like autonomy by definition directly means that they're not assistive. It can be and cannot be. When I say autonomous in the medical background, what I mean is that they are seamlessly doing all what they need to do autonomously in the background, because the final decision is still going to be assistive augmentation rather than requiring constant input, rather than requiring constant, supervision. There should be a level of autonomy that is built in at the level that it can, and then humans in loop. That's the term we use. HIP, human in loop, is needed. So therefore, there should be some autonomy within the artificial intelligence algorithm that is going to be applied in healthcare. So that is the goal, right? The goal is never to replace physicians. The goal is to augment them, right? That's the real important thing. And how do we augment them? The term we use, or I'm even developing, for example, detecting brain bleed on CAT scans. So you augment them by computer-aided diagnosis. And that's the detection, the 3Ds: detection, diagnosis, decision. This is computer-aided. This is computer-assisted. This is not computer doing it. And therefore, we need to augment the physicians. And then, of course, we need to augment physicians' efficiency, right? They can easily compare, contrast, context, improve communications. All of those, when you put AI intelligence in it, your efficiency goes much higher. And therefore, you're able to impact patients' health better and improve out. And again, I mean, this is not something brand new. We are already seeing these different technologies working in artificial intelligence throughout our lives. We have embryo selection in IVF using artificial intelligence. We have genomics being done significantly now on artificial intelligence. We have constant voice assistants in everywhere that are detecting our voice and helping us around, and we can add more technologies in it. For example, quantification of voice tremors in Parkinson's and how it affects cognitive decline. That's a good study to do. Similarly, we have wearables that are detecting EKG atrial fibrillation through algorithms. Clearly, there are smart chatbots that are doing mental health. Paramedics are using it in a diagnosis of heart attacks, including stroke, that we are regularly using. This is one of the most important artificial intelligence, and two companies, Rapid.ai and Viz.ai, kudos to them that have done some fantastic work, and I'm, prayers for them that they have done some amazing work, because as you know, I think that if you save a life, it is as if you save the life of all mankind. So, being a stroke physician, I always appreciate companies, and they should make money also. I don't mind. But whatever it is, at the end of the day, we are looking at these existing technologies, right? I mean, as a stroke physician, you now need to be trained on these technologies, where their limitations are, what their strengths are. Again, reminding you that when you are choosing your specialty, you have to take that into account. Assistive reading in radiology is now part and parcel practically. When you are looking at glaucoma and figuring out if the patient is at risk of blindness, that is diabetic retinopathy, can be diagnosed easily with artificial intelligence. This was Google's big project. And then, of course, classification of cancers. It's a big thing right now as far as the mammography is concerned, that you can do automated classification of some nodules and peripherally, look at them over time and trend them. So this is a big process that we're looking at to actually see. Again, cuts down the time. It's not the diagnosis that they make, right? It's the nodule size in the liver or the breast, how big it is getting, how small it is getting, what chemo is working. And when you put that data in more quantified fashion, rather than I am sitting there doing a boundary, and if artificial intelligence just does the boundary for me, I can move on to the real meat, the real matter, how to change the chemotherapy for that patient so that that nodule becomes shrinked, right? And of course, there's patient safeties that we have been looking at. And we are looking at a lot of predictive analysis already in terms of which seasons and allergies is going to cause increased, asthma attacks, admissions. As a matter of fact, there are seasons in which children's hospitals are packed, and, because they are unable to breathe. And there's, load balancing we can do for those patients, because we can decrease, elective surgeries in that time and then push it to another area, because that's one of the ways that we can figure out how to use our resources efficiently. So these are just examples of healthcare already happening. And so let's see what happens next. As I've been telling, more and more data is being gathered, and more importantly, it is being combined. When more and more data is gathered and combined, we're going to see that a lot of these inputs are going to become one AI system. So the way I describe this, and we're going to go into a lot more detail, is artificial intelligence as a service. What that means is that there's a specific AI now currently doing CT brain. The other one is doing CT liver. And then somebody's doing the PET CT. Somebody's doing the MRI. So these are small stacks. These are small stacks of AI modules. Those AI modules are going to combine into one bigger stack that's going to say, let's say AI in radiology. So smaller stacks of radiology bringing a big stack of radiology. Over here, another stack is building up of genomics, how to predict single nucleotide, mutation. Other one is going to predict chromosomal aberrations. Other one is going to predict something else. And that full stack of genomics is done. And that those two are combined into another bigger stack. This way, artificial intelligence as a service is going to continue to grow. And it's nothing unusual, right? I mean, you can see that initially there were ultrasonics, LiDAR, camera that were used in autonomous vehicles. And we're seeing that those different stacks are all combined into one to have an autonomous vehicle, right? So ultrasonic predictions, biosensors were differently developed, cameras were differently developed, and then other sensors, LiDAR sensors were developed in a separate way, and then they are all combined to actually drive the car forward. And that's exactly how it's going to happen in healthcare as well. So all these different modules are going to develop and then combine to give you a true wellness picture in terms of understanding your own health and then acting on it, and potentially one day they can all combine into maybe a voice assistant on your wrist or somewhere that's going to be your virtual wellness coach. I just want to get into a little bit more understanding of what autonomous means and what I mean by fully autonomous here. This is one of the ways that we describe how autonomy works in vehicles. There are basically 5 levels, right? 0, 1, 2, 3, 4, 5. So let's start with 5. Full autonomous vehicle level 5 is considered that the car can drive autonomously in any condition, severe storm, anywhere, period. That's where full autonomy comes in. And that is never going to be the number 5. You see the big cross. That is never going to come in healthcare. And it has nothing to do with technology. Sometimes there will be technologies available, but they will not be a general acceptance, period. As I said, there's things that humans are able to do, and we have seen those examples from years now, right? That we will not have 100% full automation of artificial intelligence in healthcare. We will definitely have what we call level 4. Level 4 basically means that you have practically full autonomy, but there is human in loop that is actually constantly checking on things, that there is no issues going on. And then there's if there's severe condition, there's issues, there's an automatic flag that needs to be reviewed by a human being. This is where artificial intelligence in healthcare should be. This is the highest amount of autonomy that we should expect eventually 10 years from now as artificial intelligence in medicine is concerned. The current system that we are actually in is conditional automation. And conditional automations is very far and few, but at the end of the day, in very small situations, we are already seeing that. One of the biggest examples is artificial intelligence detection of atrial fibrillation. That's pretty conditional automation, right? I mean, you can actually do that, all of this. But again, if you put in the data, patient is doing thyroid, patient is taking stimulants, all of those can be done. And then in that situation, it's already designed that if you see that data, you don't really, infer, and then you can actually push it down the data to the human in loop. So that's where generally we are. In some of these places, we are on 2, 1, and 0. So this is the scale that is best way to sort of describe autonomy of artificial intelligence in healthcare. And this is one of the best analogies that you can review on your own time. The link to this paper is also put in the description as well. And if you follow me on Twitter or blog, etc., we continuously put these out as well. Now let's talk about the elephant in the room, right? Well, human intelligence versus artificial intelligence. And that is always, for some reason, a matter of discussion. And I'm going to be honest with you, I don't really see a point of that discussion. Human intelligence did create artificial intelligence. That's number 1. And then the number 2, it's a tool. And, like electricity is a tool. You can use it, right? I mean, do we ever compare humans with electricity? It's like same thing. If you're going to compare humans with electricity, sure, you can compare humans with artificial intelligence. In short, in my opinion, this is an artificial, arbitrary way to compare things. At the end of the day, in my opinion, kind of bullshit. Anyways, but people do so. At the end of the day, I'm going to go through one of these charts for you to sort of make a little bit of sense that how we differ and what they bring, what AI can bring to the table, what we don't have, and vice versa. So humans, in terms of judgment is concerned, they have more of an intuitive sense, right? I mean, hey, when I'm looking at this tremor doesn't look like that. This is not essential tremor. Then I sit there and make sure to look at it again, then actually distract the patient, look at it, and then have an intuitive feeling that whatever the thousands of cases that I've seen before and what the intuition, etc. that comes in. But at the end of the day, AI is going to basically do what? It's going to put on the wrist, and then it's going to use that accelerometer to actually count the number of hertz, and it's going to say, this is actually 4 hertz, Dr. Kalia. This is not tremor. This is a focal seizure. They do it via computation. We do it via intuition. Excellence. We do excel as humans in creativity, still do. There are areas in which artificial intelligence like DALL-E and text generation is getting much better. Interestingly, artificial intelligence written novels are now winning first prizes as well. But true creativity, true originality still remains a human domain. Memory, and that is where the key issue comes in. We accumulate experience. We do have overall experience in life in which we are actually driving from. We have, technical information that we turn into knowledge, and then we turn into wisdom, and that wisdom piece is sort of experience, and we dole out our wisdom over time. But again, as we do not do computational, the same thing doesn't work. The benefit of artificial intelligence is that they really do not have any recall bias. They have instant recall, and eventually you're going to see, as more and more systems are going to connect, they're probably going to have perfect recall as well, because more and more data can also be pumped into AI intelligence. Activity, of course, we do activity in terms of a work, in terms of like a whole process. What we do is basically, I'm a neurologist, right? I'm not like an algorithm that just detects bleed in the brain. So our intelligence is very holistic. The way we approach things is extremely holistic. We're looking at the whole picture, and we are doing the multitasking is not the right word. Holistic is the right word. Actually, the brain really works better if you're concentrating on single task, and truly it's not multitask. It's actually one task, and we are moving from one task to another task extremely fast, and it looks like multitasking, but at the end of the day, it is not truly multitasking. It's actually looking at the holistic thing in your random access memory and then flipping through them as fast as you can. Computers are task-based, right? It's not like when I'm looking at it, I'm looking at a patient who has an intracerebral hemorrhage, hypertension, etc. They are just looking at one piece of that information, one task, if the CAT scan has a bleed or not. And of course, language. We actually do have, to be honest with you, I still think that what truly differentiates us from AI to human intelligence is language. Actually, in my opinion, the divine spark in humans is language itself. The spoken language, not communication, not regurgitation. It's our ability that separates us from animals, and hopefully one day from AI as well, but it is getting close, that we can communicate in spoken language. Not communicate, because rabbits communicate, right? Tail up, danger sign, move on. That's not communication at the level of language. We as human beings are able to communicate with language, and that is one of the ways that we are differentiating, and unfortunately it is actually the overall separation between AI and human intelligence is shrinking. Now, when we look at where we are in terms of AI, if you look at singular tasks, right, at the level of tasks, there are some tasks that computer performance is increasing, and that's to be honest with you, this graph probably represents where we are in terms of healthcare intelligence is concerned. Actually, there are a few tasks where AI can definitely have surpassed us. But if you don't have that holistic approach, it doesn't matter. You're great at one task, but so what? You are assistive. So at the end of the day, what I'm saying is that human performance does unfortunately increase over time, both in terms of the person 30 years ago, a physician was X effective. I'm definitely more effective just by virtue of the tools that I have available, the data I have available, the studies I have available, etc. So human performance does increase, but at a limited pace. Computer performance, on the other hand, the more data you give, the more compute power it gives, the performance can exponentially increase. And that is a very hard concept to grasp and sometimes accept, but it is going to be the reality. Actually, it is the reality as we speak. Again, this is one paper also that we're going to link in the description below that, you know, basically does what we're thinking of. According to this, actually, in the current state, human performance is basically outpaced with the AI performance, and actually in the future, we're going to see AI being outperforming the humans. And this is something that's going to be hard to solve for some of you, but it is the reality of things that we're going to go. Rather than fight it, actually, I would recommend to use it, because you should potentially look at, if you're doing currently your bachelor's, do a little bit of computer science or data science, projects as well, because at the end of the day, we are all, even within the last 2 decades, are knowledge workers. And moving forward, we're going to constantly move into more and more expanded knowledge that is artificially enabled and assisted. So we're going to be more dependent on AI. So it's better to know those things. A lot of people come to me and say, oh, great, it is AI and it is not the human eye. At the end of the day, human eye has more intuition. And this is what I keep telling them. Like, yes, human eye has more intuition, but at the end of the day, it is restricted by the visible length. You can't see short wavelengths. You can't see long wavelengths. You unfortunately do not and will not have enough data that the computer has. I can look at the grayscale of MRI all I want, the CT brain, but at the end of the day, I cannot do a pixel level analysis what AI can do. And it is not about my intuition. It is just impossible with my physiology to do so. And that's one of the ways that you have to understand that how things are different. Because I read a 24-hour EEGs, etc. It's just daunting to do so. If there's a person who's actually having active seizures and I have to count like 10 seizures an hour, is hard and it is impossible. I need AI. Because there's no way I have to, be able to do that effectively. And if there's just one patient in an ICU, if there's more than one patient, I have to call for help, because we have to figure out what to do as well to help that patient. So there are human limitations, period. These are biological limitations, period. My eye cannot see cosmic rays, gamma rays. There's no way I can see at the level of pixels what it is. And those data is available, right? MRI is actually, and CT scans are capturing the data. Why not analyze them? So this is where the human intelligence versus artificial intelligence also differs, because it's not just about the intelligence, right? My intelligence can be superior, supposedly. It's not. But what I'm saying is, okay, human intelligence is superior, but the input is not there. What am I going to do about it, right? One of the frustrating things you're going to do as a resident is that how the freaking attending knows everything. It's because attending gets the call first, because attending gets the text first. They get the information first. They're not freaking more intelligent. It is literally because everyone is assured that they will get the information. And that's it. It's the gap in information that is there, that is between the human intelligence and the artificial intelligence, that's growing. And that's going to be the major reasons why artificial intelligence is going to be better and eventually is going to surpass significantly as compared to human intelligence. On that note, we're going to pick up in our next lecture. Again, thanks for tuning in. If you haven't subscribed, please do subscribe. If you find someone that is interested in these kind of lectures, please do share. Thank you so much.